All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. And today we have a very special guest, Dr. Kara Pepper. Welcome to the podcast.
Thanks for having me.
Yeah, thank you so much for coming. I always like to ask everybody, tell us a little bit about who you are and what you do
Yeah.
first.
Well, I am Care Pepper. I'm a primary care internist, which means I take care of adults. I actually grew up in Florida, Pensacola, went to UF and then Miami for med school. So Florida has long been home, but I'm in Atlanta, Georgia since I did my training. And although I take care of all adults, a lot of my care is around eating disorder care. And I'm licensed in 18 states doing telemedicine all over. And then I see people in person here in Atlanta. So it's a little bit about my clinical
Awesome.
practice.
So are you licensed in Florida as
I
well?
am.
Most people, I think, when they have their telemedicine license are licensing in Florida because I think we maybe need more help to give care to everybody. So that's
Sure.
great.
Yeah.
Awesome. Okay. So you have a lot of, I guess, niches and specialties, and I understand you're a coach as well. So you coach other clinicians or other professionals too.
That's right. Yeah.
Awesome. Okay. And you also host a podcast. So we have lots to talk about today. But one thing I don't want to use the phrase pick your brain about, but one of your specialty things was about gray drinking, right?
Yeah.
And what exactly is gray drinking? How does it differ from other patterns of alcohol consumption? And tell me all about it.
I'll start by just telling you a story about how I came to be familiar with it, and then I'll
Yeah.
use that kind of as the example, if that's okay with you. I grew up in Florida, like I mentioned. I was a professional ballet dancer before I went into medicine. So I had all this perfectionism and workaholism that followed me into healthcare, and I looked really good on paper, but really felt like I was failing and not keeping up. Lots of imposter syndrome, like many of our female
Mhm.
colleagues struggle with. And so I think the pattern of behavior I had personally around alcohol was, something I did on the weekends. I went to the University of Florida, so partied and did that type of thing. But really, it wasn't something that impacted my life. And work felt very important to protect. So I never had any functional issues. It was really confined to like Fridays and Saturdays. And that's pretty much the pattern that I had through my adult life. And then the pandemic happened, as the story goes for many of us. And I was in my COVID bubble, and we'd get together and let the kids run around, and people would sit around and drink and watch football. And this pattern of like accelerating drinking, and more specifically, like I just want to kind of detach. I wanted to turn off my brain. I want to have some escape from what's happening. The intensity and frequency of drinking kind of increased. I would drink more on
Mhm.
Fridays and Saturday nights, but it was certainly not impacting my work. And if you would have asked me what my drug of choice was, I would have told you it was work, because that was a place where I could feel really productive, but not actually have to like feel my feelings. I could just take care of patients. And so I tell you that because they're really one and the same. The things that we do to try to avoid feeling or kind of check out, whether it's overworking or over shopping or over drinking or avoidance, it's all kind of hardwired in our brain in the same place. And ultimately, I decided in November of 2021 to quit drinking after this kind of infamous trip to Mexico, where I remember 3 out of the 6 days that I was there because I was just having a good time. I didn't come back with a tattoo or an STD. There was no big rock bottom moment for me. I just said, this is actually sucking my joy, and that's not okay with me. And so I tell you that because grade drinking is not a diagnosis of alcohol use disorder or substance use disorder, but it's this spectrum between teetotaling and a diagnosis where so many of us live. They think about a third of adults live in that space where maybe you're binge drinking or maybe you're drinking more frequently, and there's no rock bottom. There's no big moment where you say, oh man, I'm having consequences. You look around and think, well, everyone else is drinking as much as I am. So,
Mhm.
just live a little, stop worrying about it. But it's this persistent worry that, like, is this too much? And I, as an actual doctor, was like Googling, like, how much alcohol is too much? And like, that is a pro tip. If you're worried about your drinking, regardless of how much it is, like, that's information. So it's this gray spectrum of increased alcohol use that doesn't meet diagnostic criteria, but may increase your risk. Well, it will increase your risk for having a problem later on. And so it's this kind of silent epidemic that we've just normalized in America and in
Mhm.
healthcare.
Oh, I definitely agree that we've definitely normalized it. There's always like social memes about it. You know, you can buy your wine glass with a little like another meme or type thing on it as
Yeah,
well.
that's right.
So I wasn't expecting you to give a personal story, but I think that's so much more relatable. And also, it's you also weren't saying that you went to a doctor and they said your liver enzymes were elevated,
Correct.
right?
That's
This
right.
is just something where you thought, hmm, this is too much. So I think a lot of people can relate to that.
Yeah.
And I mean, I spent time in college and things like that, which I probably was very similar growing up. And that was the social norm. I honestly think some of the younger people growing up now are not quite doing these things that we might have done in our youth, which I find very interesting as well. But this gray area is
Yeah.
probably where the whole, I guess, name of gray drinking came up from. So how prevalent do you think it is, and kind of what demographic is most affected by it?
Yeah. So we know the alcohol use disorder, people who meet
Mhm.
criteria, it's about 1 in 10 Americans, depending on the population that you're looking at. But this high risk behavior, like the gray area, as we call it, where you're between worry and just live a little, may have some blackouts, but it's not impairing your function, doesn't look like a problem to outside people. They think it's probably around 30%, particularly in women. And we
Wow.
have just totally normalized that. Like,
Mhm.
not just, in mommy wine culture and like, hey, let's have a glass of wine at the end of the week. I mean, if you've ever gone to any social engagement, the first thing most people ask is, what can I get you to drink? But I will say, even for us in healthcare, we are taught these kind of rules about what's too much. And I'm
Mhm.
happy to kind of go through what we consider normal,
Yeah.
quote, normal amount. It's 14 drinks per week for a man and 7 for a woman, and no more than 3 to 4 at a time for women or 5 for men. But if you think about like an average football Sunday, I mean, that's like pretty standard. I think most people who are, going to be at a party for at least in the circles that I was traveling with, that's not uncommon. And so when patients would come to me and they'd be like, what do you think of this? Those were kind of the rules that I had, but I wasn't really thinking about what's the underlying question. Like they're worried about their drinking, even if it doesn't meet those rules, or maybe they're starting to see some fatigue or they're irritable or they're not showing up for their family the way they want to, and they're kind of worried about it. And many countries outside of America are now saying the right amount is zero. There is no
Mhm.
safe level of alcohol. But culturally in America, we just accept this as normal. And I will say medically, and I know you know this, that alcohol is a known carcinogen. It causes head and neck cancer, esophageal
Mhm.
cancer, gastric cancer, liver cancer, breast cancer, colon cancer. And what is so wild to me is like we would never have like a skin cancer screening at the beach on a sunny day. That would just be weird. We'd say that's probably sending the wrong message. But you will absolutely go to breast cancer fundraisers and have wine there. And so there's a real
Hmm.
cognitive gap, I think, between what we consider like, oh, it's what we do, and the reality of how alcohol is impacting our body. And we're not giving our patients that information to make decisions around.
Yeah. So you mentioned cancer as a possible long-term health consequence. Any others?
Yeah, thanks for asking. We're winking at each other
Yeah.
through the mics. Yeah, of course, there's plenty, right? So like dementia, which is 1 in 8, and certainly, 15% of people over 70, 30% of people over 80. It's a huge risk factor for dementia and nerve problems. And it certainly can increase your risk of heart issues, arrhythmias, and heart
Mhm.
failure. So when we look at like the number one reasons why people die in America, heart disease, yes, alcohol can contribute. Cancer, yes, alcohol can contribute. Dementia, which is an epidemic, yes, it can contribute. So those are just to name a few. And I don't think that we're really telling patients like, oh, did you know even modest amounts of alcohol can create these problems, in addition to the other things like car accidents and depression and anxiety. And we as primary care physicians see patients who are not feeling great all the time. And I don't find that that's a primary recommendation. Did you know that alcohol you're drinking, even just Friday and Saturday, is probably contributing to your anxiety and depression during the week? So there's a
Mm.
lot there.
Yeah, absolutely. And I think obviously some people, not only is it contributing to anxiety and depression, but some people use that as their substance of choice to help
Of course.
mitigate anxiety and depression. And I think that only, circles the problem kind of even further along,
That's right.
which is not good. Yeah.
That's
But
right.
you mentioned cardiac health, arrhythmias. I mean, I definitely see patients coming in, holiday heart syndrome, right?
That's right.
It's like one of the taglines of that you see. Usually it's AFib, like atrial fibrillation. They're coming in with an abnormal heart rhythm, usually really fast. And, they're having all symptoms of chest palpitations, shortness of breath, maybe some sweating. And, they might have had I might define it as a quote binge drinking episode, which is probably more than like what you said. I think you said 5 for men at a
Hmm.
time. Yeah.
Hmm.
But, they might not define it as that, right? But that can still, cause these kind of side effects and problems to happen. It's
Yeah.
pretty actually scary, right?
Yeah. Yeah. And we call it holiday heart because traditionally people are enjoying themselves and imbibing on
Yes.
at holidays. It doesn't have to just happen on the holidays, but it's after an episode of drinking. Yeah.
Yeah, exactly. It's interesting because I've had some patients who are coming in just regular lab work. And then I do see those elevated liver enzymes because we know that alcohol is processed, in the liver, right? And it's an acute toxicity to the liver. And I'm like, well, what happened? Like they maybe have been on vacation or something like that. And I see those elevated liver enzymes. Luckily, I do a little counseling and we repeat them and they're actually okay
Mm-hmm.
in some cases, most cases. But, I often talk about sugar being a toxic thing to the liver in a more chronic aspect. So this kind of is similar to that approach, but this is, I think any food substance or any substance, I should say, and things that you were talking about before we got on this call are things that people are kind of overdoing, right? So you can overdo the alcohol, you can overdo the sugar. And I mean, I think you might maybe later on, we're going to relate it back to overdoing other things as well, right?
Yeah.
Are there any common causes or triggers for this, do you think? Or you might have kind of already run over that, but
Yeah. I mean, we know alcohol is the third most addictive chemical in the world. So, for us to think that we're not going to enjoy it on some level, I think
mhm,
is foolish. And so risk factors certainly for alcohol use or alcohol overuse, there's genetic factors. It certainly can run in families.
mhm,
There's environmental cues. We know in certain countries where alcohol is more prevalent, you'll see higher risks or higher rates of alcohol use disorder. There's environmental factors like socioeconomic factors and what we call ACEs, adverse childhood experiences. The stress in childhood absolutely can increase your risk for alcohol use disorder as we grow up. And then there's just the cultural norm, I think, which is just like, this is what happens. I mean, I've had patients, I'm like, I'm really worried about your drinking. And they'll say, well, look, like I'm in sales. Like I can't not drink when I go out with a client. And I would question whether that's really true or not, but it's certainly culturally in many circles felt to just be really normal. That's just what you do. It's what you have to do. So anyway, we're trying to just connect the dots very often for patients to say these are the things. I will say for your non-clinician listeners, um, if many people say, well, I got a free pass because my liver enzymes were normal when I went for my
mhm,
physical, it's usually the binge drinking that will cause that acute liver
mhm.
function test abnormality. But for folks who are drinking pretty regularly, our bodies are amazing at trying to achieve homeostasis. And so, very often for people who are drinking regularly, their liver is kind of adapted and processing the alcohol, not to mean that it's doing it well, but the liver enzymes will look normal on the labs, even if people are drinking on a regular basis. So, it's not a free pass. I think that's my take home
Yeah,
message.
that's a really good point too. And they could even have some like fibrosis or other problems with the liver, even if
Absolutely.
the liver enzymes are normal. Yeah, that's a really good point.
Yeah.
Yeah. So I guess just how would you say that stress plays a role in this whole like gray drinking thing with among professionals and high achievers? Like, do you think that they're more susceptible or what would you say?
I think there's several things. We know that there is an epidemic of loneliness. Our Surgeon General has written a book about it. It's really his kind of campaign. And so loneliness certainly increases people's mental health concerns,
Mhm.
depression, and anxiety. But interestingly, loneliness, they think, is just as lethal as cardiovascular disease, not because people are dying by suicide, but because it creates this, you know, on a molecular level, some issues with the vascular system that increase risk of death. Anyway, our mental health crisis, particularly in the wake of COVID, is really high right now. And so people are
Mhm.
finding efficient, effective ways to feel better. And if opening a bottle of wine at the end of the day is accessible, a lot of people are doing that. So there's that piece. I definitely think that, particularly when we look at physician women specifically, like actually the risk of alcohol use disorder is higher than 1 in 10. They think it's closer to like 20%, two in
Wow.
or 1 in 5. So for folks who are under chronic stress and high functioning stress and don't have a lot of bandwidth in their life, their risk of alcohol use can increase as well. So it doesn't discriminate. I'll just leave it at that. It can
That's true.
affect every gender, every socioeconomic class, every profession, and because it's just so acceptable in our society. And so I'm just talking about some personal experiences on purpose because there is so much shame around drinking. Like if I admit that I'm worried about my drinking, then that may mean I have a problem. And it's totally fine to just say, I'm not comfortable with this and I want to try to find a way forward. We can talk about that if you like.
Yeah, I mean that's definitely an important thing to note. Like if you're not comfortable, you have to, find somebody that you're willing to, I guess, bring it up with as well. So how does someone, think that maybe, okay, I might be in this gray drinking area. How do I bring it up? What are signs or symptoms I'm looking for to be like watching out for it?
Yeah, so the gray drinking, I I'll just kind of go through what we think that is and then what I would tell you is helpful with that as well. Like gray drinking is again not clinical criteria for alcohol use disorder, but there's no rock bottom. It's like not a drinking problem, but you have a problem with your drinking, if you will. You want to stop drinking and maybe you've done dry January, but you always kind of end up going back to what you were drinking before. Like, oh, I took a break and now I'm back at it. You kind of vacillate between like worrying and just living a little. You may have some blackouts, but it's not impairing you in terms of a DUI or impairment at work. So it's in that behavior. And so my first, I guess I have two pieces of advice. One is if there is even a small part of you that's like, maybe I should drink less, just listen. There may be 1,000 reasons why you don't want to do that, but there's a part of you that's a little worried. So just acknowledging, even if that's privately, that this is something on your mind, I think is a great first step because we often want to just shove it under the rug and not
Mhm.
acknowledge it. And then the second would be, what would it take to just not drink for the next 4 weeks? Like, what does that even bring up in the thought of that? Does it feel embarrassing? How are you going to tell the people around you? Does it feel really scary? Just acknowledging what that experience might be like, and then practicing. What would it be like to stop drinking for 4 weeks? And if you cannot wait till the end of 4 weeks to pick it back up again, that's information. Like, wow, there's really something that's going on. Do I have anxiety? Do I have depression? Do I have social pressures? Like, what is encouraging me to get back at it? And just, you never know what hangs in the balance of these decisions. I'll just tell you again, once I quit drinking, which there's a lot more detail to that story, but once I did, it's opened a conversation with my teenage kids that I don't know that I would have had the
Mhm.
credibility to have before this. Both of my kids have ADHD, and we know that half of kids with ADHD have substance use issues. And so for me to kind of lead by saying, you have a brain that's primed for addiction, and I recognize that I was having a problem and I wanted to quit, and my son will now tell you these stories like, oh, remember that time you're on vacation and you were being silly and whatever. Like our kids know. And I think many parents worry about what hangs in the balance for their children. And your decision to maybe get sober for 4 weeks may open up conversations that you don't even know you could be having as a great parent for your kids and leading by example with them. So if not for you, it's okay to do it for someone else.
Yeah, I love that. I think that's super important, like setting an example. I liked your comment about dry January because people always like seem to start over. You had your New Year's Eve party, and then, the next day, January comes and they kind of use that as a stepping stone. So I think it's a
Yeah.
great opportunity to do that. But like you pointed out, that could be any 4 weeks of the year to do, right?
Yeah.
Yeah, absolutely. So you mentioned, well, one thing I wanted to comment on was the loneliness. So you mentioned how it was like a risk factor for some things and maybe even like shorter lifespan or medical problem. Well, it's funny because like all the longevity studies say the exact opposite, right? That all the people with social support and everything tend to live longer. So I think that was a really interesting thing I just wanted to comment on.
Yeah. Yeah.
And then you also said something, the brain is primed for addiction. So what other like patterns or things could be going on with someone who's kind of already quote primed for these habits?
Say more about your question. I want to make
Well,
sure I
are
answer it
they
correctly.
going to be substituting one thing for another? Like if they stop drinking, like what are the
Yeah.
fears of what could be happening and things like that?
Yeah. So often, um, and as I mentioned, or I may have mentioned that, 90% of my clinical practice is eating disorder care. And so
Mm.
I see that, I think, even in that patient population where when you're trying to let go of one thing that's not serving you, it can sometimes feel like whack-a-mole. So you may quit drinking, but then you may realize that you're having increased cravings for sugar, for example. Or
Mhm.
like you say, okay, great, I'm going to give up alcohol and I'm going to watch my sugar intake. But now I'm finding that I'm just like really antsy and I'm like finding all this busy work to do and I'm just busy all the time. Like, or maybe I'm like doing more window shopping all of a sudden and I'm like more Amazon boxes are showing up at my house. We as humans do things that either make us feel better or avoid feeling bad. And without getting into like the, you know, neurotransmitters in our
Mhm.
brain, I mean, the truth is like we all want to try to feel better. And so if alcohol is at least temporarily relieving some anxiety, even though it's absolutely contributing to your anxiety,
Mhm.
you may find that it's going to show you're going to find other solutions for that problem. So that is also information. If you're like, great, I'm sober, but now all of a sudden I'm, you know, doing something else, it's worth just
Yeah.
noting and solving for the underlying problem.
You mentioned, I guess, how anxiety gets better with alcohol. Some people often mistake that their sleep gets better with alcohol. Why? Because they can fall asleep pretty quick. But the
That's
problem
right.
is the
Yeah.
sleep, restorative process is terrible. Like you're usually
Yes.
they're tossing and turning and they're not getting good sleep. It's just that they were
Yes.
able to fall asleep easier. So usually that's something I really bring up and make sure that they're not doing if we're talking about sleep as well. So
Yes.
that's an important
Yes.
one.
Because as the alcohol gets metabolized, it causes this rebound effect. And so
Mhm.
that's one of there's many reasons why I decided to quit, but one of those was that I was like having all this sleep problems. And I was like, oh, I'm probably just perimenopausal. It's probably all this stuff. And once I quit drinking, my sleep is like rock solid because I
Mhm.
wasn't having that like early, like 2 or 3 a.m. wakening. And like I mentioned, I was only drinking Fridays and Saturdays, but I was like recovering through the week from those like 2 really bad nights of sleep. And so I just thought, oh, I just have insomnia. But in fact, it was just the alcohol.
Yeah. Well, I will share a little bit about my journey, I guess, with the alcohol. Like I said, I went in college, we definitely had fun, and then even maybe a med school. And then my migraines started getting out of
Hmm.
control. So I think, I mean, I get migraines for many reasons. I still do, but like that was definitely one that would put it over the top.
Yeah.
And I'd have to use injectable medicines to survive from that. So I kind of stopped for that reason. And then, I was pregnant for like the last 10 years or nursing or something. So that was always a good excuse, right?
Hmm.
So, oh, I'm not drinking. Oh, it just gives me a headache or, or I'm nursing or whatever. So I always had that nice excuse. But how do we move forward and create like the social norm of, it being okay not to have alcohol at every event or say, oh, no, I don't need that. So how do we move forward in making it more normal?
Yeah. So several things. Like one is if you are someone who is trying dry January or your next 4 weeks, I think pre-planning and having some comebacks, if you will, like, oh, I'm just doing dry January. I want to do that for my health. Or, oh, I'm taking a break. Or, oh, because you may not want to disclose that you're pregnant, for example. Like, oh, I'm doing it in support of a friend who's also getting sober. Like you don't even have to like own it for yourself. But I think having some pre-planned things, especially if it's a high pressure environment that you're used to drinking in. I think coming prepared with non-alcoholic beverages to a party is also really helpful. Or if you're hosting an engagement, to have something besides water there. We can just normalize that not everyone wants to drink alcohol or water. And then I think the more that we just get curious about it, like what does it mean? And talking about this socially, it's not this big stigmatized thing. I think people talk about their blood pressure, they talk about their diet, they talk about their exercise patterns, but somehow alcohol feels like a kind of a no-go. We can't talk about, oh, I don't really like
Mm.
what it does for me. So I think the more that we just normalize these conversations, especially for those of us in healthcare with our patients, then that can be really helpful. And I think really knowing your why behind any behavioral change, whether you're trying to start a new exercise program or quit drinking, really kind of tapping into that thing that matters most to you is really important because we often will have these big goals like, I want to be healthy, which is nice, but that doesn't really mean anything. But if you're like, I have got to stop drinking because I'm so worried that I'm going to end up with dementia like my mom, like that feels a lot more personal, a lot more immediate, a lot more tangible. And so, really tapping into something that feels meaningful to you can really help you stay motivated. And as an aside, I personally had done dry January many years. In fact, the first 6 months of COVID, I did not drink for 6 whole months. Like I didn't. And the fact that eventually I would always kind of return to my Friday and Saturday patterns when 2021 came around for me and I decided to quit, I knew that I needed to quit permanently because I had quit so many times in the past.
Mm.
We say on average, it takes quitting smoking 7 times before you actually quit smoking. It's no different with alcohol. So even if you quit for 4 weeks and go back, that's information in your back pocket that you can use later if and when you decide this is actually not serving me. I want to quit for good.
Yeah, it's definitely, you have to have that why. I mean, even like you mentioned, like for the kids example or something like that, I
Mhm.
think that's really important. And obviously, if you keep, bringing it up and trying to quit, like clearly there's a pattern there that you want to not be reintroducing it. I think that's
Yeah.
great that you were able to find that. How do you help patients do the same?
I just, again, normalize this conversation like, hey, you seem like you're under a lot of stress. A lot of people who are in your situation are finding ways to feel better. What does that look like for you? And that will open a door to all kinds of things that I may not have expected. I asked very directly, tell me about your relationship with alcohol. What's that like? Do you ever worry about it? And that question, do you ever worry about your drinking, is, I think, so much more indicative than anything else that we could ever ask our patients, because that really kind of gets into the stages of change. Anyone who's coming in for any mental health disorder, I will tell them, like, this is a chemical that's causing, imbalances in your brain. And I think getting into a place of sobriety, at least temporarily, is going to be really helpful for your mood. And just kind of talking very candidly. I mean, we have patients, you may have a lot of women patients just like I do. And, people are seeing me for breast cancer prevention and they're so worried about breast cancer. I'm like, have you thought about quitting drinking? Like, you're doing all the stuff to try to prevent
Mhm.
cancer. Like, have you thought about not drinking alcohol? So just naming it neutrally without shame and being open ended, I think, can be very helpful for our patients because they don't know
That's a
either.
great point. Obviously, tying it back into the health risks as well.
Mhm.
It's funny, there is a new, I want to call it a bar, but I don't know what they're calling themselves, bar in like St. Pete area that they're not providing alcohol, but they have
Yeah.
some sort of fun
Mocktails.
thing.
Hmm.
Yeah, it's like a mocktail thing, which I think is a really neat thing. They're trying to make a new social norm for that. And
Yeah.
I wish I remember the name of the bar. I'll have to look them up and link them to here or something and recommend it, but I haven't been. But yeah, I thought it was a really neat concept that I think things are turning a point really
Yeah.
for
That's
some,
right.
we're creating a social norm, which I think is good. Yeah. And
That's right.
obviously in the doctor's office, we should be not stigmatizing and
Yeah.
obviously just keeping an open mind.
Yeah.
Great. Is there anything else that you'd like to add on this topic?
No, I think, well, yes. One is, you and I are talking about alcohol, but this can happen for any kind of escapist behavior. I mean, THC is legal in Florida. It's medically, get a medical card, I think, for,
Pretty easily. Yeah.
yeah. So, if you are having similar thoughts about THC use, like, it doesn't actually matter what the substance is. It can be
Mhm.
any other habit or behavior. It can be like smoking, it can be over shopping, it can be, overworking. Any of these behaviors can be part of that. So you can substitute your behavior in for alcohol and just listen to this podcast with that reflection. And ultimately just having some compassion that our amazing brains are trying to make us feel better at all times. And so this may be something that's no longer serving you.
Yeah. And how can they reach out to you if they want some help on that?
Yeah, so if you can remember my name, which is Kara with a K, Kara, last name Pepper. Yes, I'm Dr. Pepper. So karapeppermd.com is my website, and you can find me there.
I didn't even think of that till you said it, but I do love it. There's a personal story behind that. I'm not going to share. That's really funny. Okay.
Yeah.
I'm sorry. Well, yeah, thank you so much for joining us on the podcast. We will put all the links to socials and things like that in our show notes. And I mean, this has been such an enlightening conversation, and I'm glad that I know what great drinking is now, so I can bring it up with patients and
Yeah.
anybody else and try to make everything seem more normalized. So I think
Yeah.
that's great. Yeah.
That's right.
I
Well,
really appreciate it.
thanks for having me.
Yeah. All right. I'm going to hit stop.